Can acupuncture on the bladder meridian improve bladder control? Imagine a treatment that works with your body's natural nerve pathways to help manage bladder issues. Acupuncture targeting the bladder meridian has been explored for this purpose, but what does the science say? While some studies suggest it might help with conditions like overactive bladder and urinary retention, the evidence is still limited and not conclusive. Acupuncture is believed to influence bladder control by affecting nerves that send signals to the bladder. When certain points along the bladder meridian are stimulated, they may help calm overactive nerves that cause frequent urges or involuntary contractions. This might reduce symptoms like urgency and frequency. It is also thought to impact brain areas involved in controlling urination, such as the parts of the brain that process bladder sensations and reflexes. However, these mechanisms are still being studied, and more research is needed to fully understand how acupuncture might work in this context. Common points used in acupuncture for bladder issues include BL31, BL32, and BL33, located near the sacral nerves that supply the bladder. Other points like BL23, BL28, and those on the lower abdomen are also targeted because they are believed to influence bladder function through nerve pathways. Some practitioners also use points on the legs, such as SB6, Street 36, and Key 3, which are thought to help boost overall energy and support bladder health. In terms of scientific evidence, animal studies have shown that acupuncture can reduce bladder overactivity by calming nerve signals involved in bladder contractions. Human studies have reported some improvements in symptoms like incontinence and frequent urination, but these results are often from small or less rigorous trials. Meta-analyses indicate that some patients experience relief, but the evidence is inconsistent. For urinary retention, acupuncture has shown potential to promote spontaneous urination and decrease residual urine, but again, more high-quality research is needed. It's important to remember that acupuncture is generally safe when performed by trained professionals. However, it should not replace standard medical treatments, especially for serious conditions like bladder cancer or severe urinary problems. The idea of meridians and energy flow is part of traditional Chinese medicine, but it is not supported by modern anatomical evidence. Always consult healthcare providers for personalized advice and treatment options. In the context of bladder health, acupuncture might offer some symptom relief for functional issues like overactive bladder or urinary retention. But it does not treat underlying conditions like bladder cancer. If you are considering acupuncture, discuss it with your doctor to ensure it complements your overall treatment plan. In summary, acupuncture on the bladder meridian could help improve bladder control by modulating nerve pathways, but current scientific evidence remains limited. It is best viewed as a complementary approach, and more research is needed to confirm its effectiveness. Always seek guidance from qualified healthcare professionals to make informed decisions about your bladder health.